So how do our expectations about food influence our reaction to food? So this is a very important topic that is often not politically correct to talk about it, because a lot of people are convinced that whatever diet that they're pursuing has had a tremendous effect on their well-being and their health. And it may not be the diet alone, it may actually be the mindset and the conviction that this is good for them. So you could call it a placebo effect or an expectation effect. And this is also true both about the positive effects of some of these diets. So if you take it, patients that swear to a gluten-free diet being essential to their well-being, that may be true to a small percentage of the population, but not to the 40 and 60% who spend lots of money on gluten-free food because they think that that food is harmful to them. This gets into this whole area that Michael Pollan has once called the national eating disorder in the US, that people are so concerned and so afraid of certain foods, be it sugar, be it gluten, be it carbohydrates, that they actually, when they are exposed to these foods, develop side effects and do not feel well. So this is something, the mind has a very powerful influence. As we talked about, the mind can set the stage for, so to speak, the table for the microbes where they have their meal. And if there's always a negative influence coming from the brain in association with a particular food, the microbes will probably process food differently than if you are in an enjoyable company, festive environment, and really enjoy the food. So this, I've seen this so many patients who were thought to be hypersensitive to gluten in the US. Student, when that student spent a year in Italy, she could eat any gluten-containing products without any side effects whatsoever. Minute she came back to the US, she developed the same expectations again. And she told me she already was worried on the plane that when she gets off the plane that her symptoms would come back. So in my opinion, yes, there is differences in the quality of the food between the US and Italy. But that alone would not explain such a dramatic difference between her state of health, eating the same types of food with containing gluten in both countries.